You talk about, so when you worked in the regional
Yeah.
WA and the metro area, could you talk about your experience in terms of the healthcare, not just availability, but more of delivery as well of healthcare services? And then, you can have an angle, the lens of dentistry.
So my first job as a fresh graduate was in Exmouth as the full-time general dentist, the only dentist in the town, the only dentist for 400 kilometres. And so you're thrown in the deep end and you sink or swim, and your patients kind of sink or swim a little bit with you, but you've got to maintain that professionalism, of course, as well. And patients are very understanding in the country in the sense that they might know that you're quite inexperienced, but they're also okay with you trying something for the first time because it actually does help them. And even if it doesn't quite go to plan, they were very forgiving and they would still talk to you, chat to you, etc. So there was, I think, 3 doctors in the town at the Exmouth Hospital, and all of us would travel to Onslow as well to deliver, health services plus dentistry as well. And so the town of Onslow wouldn't have anybody there full time, but they would have someone there maybe 1 or 2 days a week from the medical side, and from the dental side usually 1 week a month. So people are waiting with toothaches, with pain, to get access to care unless they want to drive 3 to 6 hours somewhere else. It was a fantastic experience. Isolating in some ways on a personal level, but professionally you had to grow, you had to develop. And again, it was my way of wanting to give back to the community. That was one thing I wanted to do, was go to do country dental services and just experience that life as well.
And then how do you draw parallels with this country to metro?
Yeah, metropolitan, there are still difficulties with access to care in the public dental system. There's long waiting lists, but emergency dental care, they generally don't have to wait more than a day or 2 days if they need something. So there is certainly services available, but the public system is still, I would say, often understaffed, and there's still a lot of need with long waiting lists for general dental treatment to be done.